Hello everybody, this is Dr. Greg here for Greg TV channel. I would like to welcome you all and I would like to thank you for watching my videos here. So I would like to explain to you first what is this channel. So this channel, some explanations on how the new disease works. Okay, so anything medically related will be tackled in this channel. Aside from that, I would also be uploading videos of some of my personal adventures, experiences, but mostly my videos would be on the who and how or what or why of medical importance. Okay? So don't forget to subscribe and please click the notification bell so that every time I come up with a new video, you will be the first to notify. Okay? So, and now my topic will be the real problem that has engulfed everybody. Okay, this is the global pandemic, the novel or new coronavirus 19. So, or as we call it, the COVID-19. So, what is the novel coronavirus? So, the novel coronavirus is a family of viruses from the corona family. Okay, so this virus really originated from another species of animals. So, particularly bats. Okay. So, what type of bat? The coronavirus is common among bats in North America and also in China, in the Wuhan area. And it's mystery to all how this virus was transmitted from animals to humans, because transmission of viruses from different species occurs many years before a virus is capable of jumping from one species to another. So this zoonotic transmission, it is very rare. It's not common. So until now, this has been the mystery that's shrouding this virus. Okay? Aside from that, this coronavirus is really highly infective. So it's like a flu virus, but with the ability of a SARS in terms of wreaking havoc among human beings. It can kill. So how does coronavirus transmits or infects people? Okay, so first of all, like any ordinary virus, okay, this is a non-living protein encapsulated material. So it needs a host to survive. So if we stop the transmission from an infected host or human being to another, then we can stop this virus. However, it's really difficult, almost impossible to do that, because limiting human movement across the globe is impossible right now. And what we can do is to limit the transmission within ourselves and the people around us. So that's the easiest and most feasible way to help prevent the spread of this virus. Okay. So what is it? So the coronavirus is a 0.06 micron size virus which infects people through air droplets. And recently they said it's aerosolized, so it stays in the air longer. Okay. So what happens if you get the virus? Okay. So how do you get it? You get it from inhaling the virus through the air. Probably it came from an infected person through sneezing or talking or coughing without mask. It's in the air, you inhale it, and then the virus attaches to the mucosa or the inner lining of your nose, your mouth, even the mucosa of your eyes. So if you get it and it attaches to your body, then it starts to gain entry inside you. And once inside, it will attach to different cells, no? From your red blood cells, no? From the cells of your organs, the lungs, no? And if it invades your organs, no? Specifically cells of your organs, what it will do is it will create a mechanism so that the protein inside the virus will start to replicate into millions of copies. And after this process, the virus will destroy the cell which it used to replicate itself, and so on and so forth, until millions and billions of duplicate copies of this virus, this protein, will overwhelm the body of a human being or any animal. So once a virus replicates itself into millions of copies inside your body will develop symptoms, no? It will have problems, no? It could be a serious infection which can cause patient to have serious lung problems, serious blood problems, heart, intestinal problems, neurologic or brain problems, or it could have fatal complications. So this virus normally causes lung destruction. So when the virus enters the body of a patient, within the next 3 to 5 days, the patient has difficulty in breathing. So the patient usually first complain of low to high grade fever within the first few days, then starts to have throat pain, nasal retropharyngeal or nasopharyngeal pain, plus coughing. Then after a few days, the patient will start complaining of shortness of breath. So from the shortness of breath, during this time, the patient is most probably already contagious and he doesn't know that he has the virus. And because the symptoms is just similar to the common flu, that's why the patient does not think that the condition is serious. However, within the next few days, the shortness of breath becomes becomes more serious, and the patient will start gasping for air and will be taken to the hospital, and after which probably will be confined to the intensive care unit and will be given antiviral medications, supportive medications, and most probably be intubated. Intubated means a tube is inserted into your mouth all the way to your airway near the lungs, already the bronchus, and is attached to a respirator. This respirator will produce the needed oxygen to help the patient survive. Okay? It will provide pressure for the lungs to expand and for oxygen to gain entry into the body, hoping that the patient will recover. Patients who have complications and eventually succumb to COVID-19 are not allowed to be visited by relatives, nor they be allowed to be displayed in a funeral. They are immediately sent to the crematorium, okay? And their ashes distributed or being returned to the family. So the family members don't have a chance to say goodbye, and the patient doesn't have a chance to see their loved ones. And this is sad for all the patients who have been infected with the coronavirus. So how do we fight this virus? Viral medications, antibiotics, steroids, the controversial hydrochloroquine. I mean, these are all not really reliable. So there's really no accepted or 100% definitive treatment for the coronavirus. That is why it is really scary, because the only option we have to really fight this virus is a vaccine. So we don't have the vaccine yet. So what can we do to prevent getting the virus? So the very first thing that you should do is to create a barrier between you and everybody else around you. So how do you do that? So you wear a mask. The mask prevents for you to inhale infected particles even in the air. It helps, and it also prevents you from polluting the air with particles of your secretions. So wearing a mask is number one. Number two, you distance yourself from all the people around you. You treat everybody as if they were infected, and you treat yourself also the same way. So you should be at a distance of at least 6 feet every time to anybody. So if you are within this distance, it decreases your chances of getting infected. Plus, adding the fact that you're wearing a mask adds to the decrease in chance of you getting infected. So you combine the two, it will help you prevent getting the virus. And the third and the last recommendation is the hygiene. Washing your hands is number one, because washing your hands with water and soap for 20 seconds will kill the virus. It will disintegrate the virus into different harmless particles, and this will prevent you from infecting others. If you don't have soap and water, then at least use alcohol, face mask, social distancing, distance yourself from other people, and washing your hands frequently, or applying antiseptics like alcohol will help greatly in preventing you from getting the virus. I hope I have given you insights and good information which will help you in protecting yourself against the new coronavirus, and keeping yourself distant from other people will help protect you, okay? Until such time that a vaccine is available, so that we can stop this pandemic. So again, I would like to thank you. I'm Dr. Greg from Greg TV channel. So don't forget to subscribe and click the notification bell, so that every time I come up with a new video, you will be first to get notified. Okay? And watch out for my other videos. Okay, so again, thank you for watching. God bless. Bye bye.